for competition? And also I wondered whether you had any comment about the Russian team wearing masks.
There are currently 32 athletes in isolation, 50 athletes have been discharged from isolation, so more leaving than going in. In one sense, to your second question, there is no absolute figure which says if you're above this figure you're okay, if you're below it you're not. You know, we have protocols for what the CT value in the test might be, but the reality is we look at the pattern of tests over a period of days or weeks to see, are we convinced that this is a case that people are doing this intermittent positive testing, they're shedding dead particles of virus, they don't have live virus in the system and therefore not infectious, so they can move into the close contact protocol.
To ensure, you know, our reporters getting the experience and the culture experience as well?
I mean, isolation is not good for anybody, and we know around the world that the isolation that's been caused by COVID may turn out to be one of the long-lasting damages that COVID has caused to people around the world. I took part in a call on Sunday arranged by the Athletes Commission with athletes who are in isolation. And I understand the frustration, the stress, the disappointment that they feel after all the preparations. And it is not a good place to be. But we are trying to improve that for them. And that's why we've developed the protocols to allow as many people out of isolation as possible. The reality, however, is I can't make the pandemic go away for the duration of the Games. The pandemic is real and the risk is real. So we have to manage the risk. So we have protocols. We will allow as many people as possible out of isolation to train and compete as we can, but only as many as we can do safely and not pit other athletes, other participants, or the Chinese population at risk. In the meantime, we will do our best to look after those who are in isolation, but we have to be sure we manage that risk properly.
And Dr. McCloskey, I wonder if this raises any concerns or cautions about moving so many people.
Our understanding of coronavirus has been changing constantly over the last 2 years. It continues to evolve, and as it evolves, we review the situation in terms of our protocols. But they are based on science. The difference, I say, is the difference between those people who test positive because they're continuing to shed the virus and the fact that we are now seeing people testing positive who are reinfections. That was not something that was known about even 2 months ago until Omicron came around. So the possibility that somebody is a new infection and is therefore infectious has been developed over the last 2 months, and our protocols allow for that, but that is still based on the science around the world about reinfections.